early morning stiffness is one of the first symptoms. Then you're going to get pain in the joint, maybe swelling in the joints, loss of function in the joints.
I'm so happy to welcome Integrative Medical Doctor David Nye back with us today. It's a big topic, so we're going to split this up into shorter video clips. We're talking about arthritis, osteoarthritis, rheumatoid arthritis. Welcome, David.
Thank you, Gillian. Lovely to be back.
Let's unpack this whole thing. What are the differences between these conditions?
Well, I think we need to sort out the terminology, because arthritis is a very general term. And arthritis is like an overarching name for a whole lot of different kinds of inflammation. So arthritis merely means inflammation of a joint. And under that we get different kinds of arthritis like osteoarthritis, rheumatoid arthritis, psoriatic arthritis, gouty arthritis, and many others. So each one has different causes, effects, origins, treatments, and often is confused. So I think if we get the terminology right, then we can be more specific.
Okay, so how would one identify which one you have? How do they vary in symptoms?
Well, let's take, for example, comparing osteoarthritis and rheumatoid arthritis. Osteoarthritis is very much to do with degeneration and lack of build-up of cartilage in the joints. There can be hereditary factors there. Rheumatoid arthritis, on the other hand, is very much more an inflammatory process where there's actually inflammation which is destroying the synovial membranes and destroying the lining of the joints and destroying the cartilage. So they have different causes which make the treatments very different.
And symptomatically, how different are they? Talking pain levels and activity management.
All arthritis is going to have a lot of common symptoms. So you're going to maybe start off with some early morning stiffness as one of the first symptoms. Then you're going to get pain in the joint, maybe swelling in the joints, loss of function in the joints, sometimes redness, and all these symptoms can be quite common. So just looking at the symptoms alone doesn't always tell you what kind of arthritis it is.
And the causes of it?
I think that a lot of it can be genetic, so it can be passed on in families. If your ancestors had osteoarthritis, you can often have a tendency to get it. You get primary osteoarthritis, which is really where the joints start wearing down, primarily in the fingers and in the weight-bearing joints like your knees and ankles and hips. And that comes on as you get older, in your 40s and 50s. The joints start wearing down, overuse, and you get the symptoms developing from that. You can get a secondary osteoarthritis, which can arise from having trauma. Maybe you were a rugby player when you were young and you hurt your neck, and then 40, 50 years later you start getting osteoarthritis in the neck. You can get secondary osteoarthritis from other causes as well.
So like running, for example, as well? I mean, impact on your knee joint?
Absolutely.
Okay.
You're going to have extra overuse of those joints, which makes them more prone to damage if you're not healthily building up that cartilage again.
But that's difficult to do, building cartilage.
It can be, yes. You need a healthy diet, you need all the right circumstances to build up that cartilage, or to regenerate the cartilage when it wears down.
But you are more an advocate of prevention always, better than cure.
Absolutely, and
So
I think having a healthy diet, having lots of
sense.
antioxidants, which you would get from all your brightly coloured fruits and vegetables. Antioxidants are very important for osteoarthritis, so you need to have a healthy diet, you need to have exercise, you need to put your joints through moderate exercise, not excessive exercise, so that the circulation is flowing, the blood is coming into the joints, so that they can rebuild the cartilage.
If someone is in pain, it's difficult for them to move, but you're saying movement is still very important. So would you say something like swimming, or I don't know, gentle bouncing on a trampoline rather than hard running on the road?
Yeah, gravity obviously is what brings it on in the first place, so you don't want to have heavy impact kind of exercise. So gentle exercise like rebounder or swimming, where the gravity is taken away. But you've got to listen to your body as well. If your body is screaming in pain, then don't go and exercise. But if you've got mild pain, or you've got morning stiffness, and you can relieve that by going for a nice gentle walk, then that's the best thing to do, because that's really going to relieve the pain and improve the blood flow and the circulation into the joints.
And your own management of it. You know, of course we can talk about other modalities like acupuncture and that kind of thing, but I mean massaging your joints, is that something that you can do before you go to bed at night, or anything else that you can do yourself without ending up with a drug treatment protocol?
There are lots of things that one can do. Lots of things like massaging certain natural products into the joints to improve the circulation, to improve the lymphatic drainage, to take toxins away from the joints. Exercise, rest, all those things are appropriate. Heat therapy, cold therapy, and I think when we talk about the management, we'll cover all these things in more detail.
And then also the inflammatory component that needs to be managed.
Inflammatory component is very different, and that takes a completely different approach. For example, with rheumatoid arthritis, which is very inflammatory, we need to look at what's causing that inflammation. Are there foods perhaps that the person's eating that the body might be intolerant to and that's triggering inflammation through a leaky gut mechanism? It stimulates inflammation via the immune system. And there one needs to find out, is the person perhaps eating gluten, which might be causing the inflammation? Are there other foods that might be causing the inflammation? And very important to then remove those from the diet, otherwise you don't have any hope of any kind of healing.
Is there any hope for someone to reverse any or all three of the different components?
Absolutely.
Of arthritis?
Yeah, no, I do think that there's every hope to get enormous progress. Maybe not 100% resolution, but certainly to relieve the pain, to stop the progression of the illness. There's a lot of things that one can do.
Great.
Another thing that I think is very important that one needs to look at is toxicity, because toxicity in the system, particularly from mercury or those kind of things, can have a very important impact on something like rheumatoid arthritis, where your immune system wants to be functioning 100%, and mercury toxicity would hamper the immune system working.
Are you seeing that in your practice?
Yes, we see a lot of people with mercury toxicity. Unfortunately, we are the generation who had mercury fillings put into our teeth when we were kids. And until all those fillings have been taken out and the mercury is cleaned out of the body, we're going to see a lot of problems ongoing.
I'd love to have you back just to talk about that and potentially the treatment of that.
Sure.
But let's get another episode going where we talk about the management of arthritis. Thank you, David.
You're welcome.